Hi, this is Austin Waldecker with Mobile Solutions for Healthcare, specifically the rising costs of healthcare. And just a quick overview, we're going to look at the factors and the significance of the rising cost of healthcare and what is known about that. We're going to look at some collaborative efforts I found with local interviews and how they provided insight on how mobile technology can be a great solution in the right setting in healthcare. And we're going to look specifically at the app I chose, the Showcase Shorts, and how it's available and what it does. And then finally we're going to close with how exactly this is going to solve everything when it comes to the rising costs of healthcare. Now, what are some of the causes with the rising cost of healthcare? Some are the inefficiency of the hospital model and practice model. Another is the primary care physician shortage and over-specialization of doctors in general. Of course, investment in medical technology, in fact, leads to rising healthcare costs, and spending end of life does as well. In looking at the inefficiencies of the hospital model, we can see that this is really due to poorly coordinated integration and a lot of waste that happens with that. With the PCP shortage, we can see doctors are going to where the money is. The money's not in general practice. The money's not in rural areas. And the investment in medical technology, while Americans want the best and the fastest and the newest, in fact, the data is showing that the improvement in the quality of care is not necessarily great enough to justify the cost. And spending at end of life, one staggering statistic I found was that elderly care annually is 4 times greater than non-elderly care. Who is affected and why? Of course, everyone is affected throughout the United States, but poor populations are affected as well. Blacks are more likely to be economically disadvantaged than white. Hispanics have 21% living below the poverty level. As we know, poverty, unstable economic status is a poor quality of life. Healthcare is not made a priority. And then, of course, you have isolated communities, rural population. Well, 20% of the country's population lives in a rural setting. Only 9% of doctors actually practice there. So they're completely underserved. And then you have individuals living with chronic diseases, diabetes. American Indians are twice as likely to suffer from diabetes as their white population. And then, of course, the uninsured. The uninsured are 3 times more likely to defer seeking medical treatment. This has the potential to lead to more costly treatment down the road rather than inexpensive prevention. So what would be different if we were able to use this mobile application to help slow the rise of healthcare costs? Hopefully we'll be able to correct some of the current unhealthy trends in this nation. Obesity, 2/3 of adults over the age of 20 are considered overweight. 1/3 of that segment is considered obese. Diabetes has become a chronic disease thanks to medical technology. However, chronic diseases again are a huge drain on resources. And then smoking is also a big one. A statistic of $14 billion annually is wasted due to smoking and smoke breaks. And of course, a cheap app available to everyone or a free app available would help those that can't afford or can't seek access to healthcare. Whether that be inability to transportation, inability to take a break from work, inability to speak English to receive healthcare. And then hopefully this would lead to the disruption that is clearly needed in the industry, and we can find an improved model, destroy the hospital within the hospital model, seek effectiveness and cost control. Some of the things associated, again, with the rising costs are an overloaded ER, either lack of availability or lack of awareness of general hospitals and primary care physicians. Many people turn to the ER, and it's become the family doctor to many. Unfortunately, 30% of those that seek emergent care do not need it. Instead, it's acute or subacute. And that's a huge strain on resources for the hospital, tying up physicians, but more expensive and potentially more hazardous procedures. Let me talk a little bit about the inefficiencies of the hospitals. Again, unintegrated, sort of piecemeal together, and a patient sent from specialist to specialist. And instead of having true integrated care, it's very disjointed, connected, and results in lower care. And that's also very, very risky. And technology in healthcare and medical technology is, by itself, technology in every other industry lowers costs, and everyone has a better quality of life. Workers, companies, consumers. However, in healthcare, new technology means greater costs. You have new service fee greater than the previous one. You have to train a new specialist or train a new old specialist new, and there's new cost there, and unfortunately the patient, the consumer, loses. Of course, there's been previous attempts to manage care before. You had health maintenance organizations formed with Nixon in the 1970s. And this was great. You had gatekeeping. You had a primary care physician help coordinate and send referrals to specialists as needed and do the primary care through them. And it was very effective at controlling costs, and it worked for a while at slowing the rise of the cost of healthcare, especially when they began to rise dramatically at the end of the 70s and the early 80s. Unfortunately, even with the popularity and the added freedom that a PPO model offered, consumers found it too restrictive, and again, American mentality of freedom prevailed, and people revolted instead, opting for, physicians that they're choosing with technology, despite the costs. Kaiser Permanente is a great example of true integration, of coherent integration. And, considering it was formed in 1940, very forward thinking. It had a innovative business model, a group prepaid plan. It had a stance towards preventative care, and it was well thought out and it flourished because of that. It now has 34 hospitals, and its model has been expanded to other companies. And, if you're in California on the West Coast, it's a very envious model to be a part of. And I collaborated with a couple local people with ties to healthcare and medical profession. First was Barry Nelson, D.C. He's run his own practice for over 30 years here in the Coachella Valley, and in that time has expanded to include many services beyond being a chiropractor. He offers a waistline reduction laser, inflammation reduction laser, as well as alkaline water free to his patients. And he's a man who has embraced technology. He uses Yelp and has been contemplating a Facebook page to help promote his business, and has canceled his Yellow pages due to the ineffectiveness, and prefers Yelp now. My second interview is with Thea Rab, ND, recently graduated 2011, moved to Desert a couple of years ago, and uses mobile technology to help coordinate with her patients to help check in, and she has a Facebook page and very much uses mobile solutions as a part of her day. And my third interview was with Miley Nelson, previously certified as a personal trainer. She has a very active and fit lifestyle, very healthy. She also uses activity tracker, Fitbit, and just loves being active and uses that mobile technology to help reform her activity and, you know, be healthier more efficiently. And now to the app, the short showcase, again designed by CB Studios Entertainment Network, available across almost all the platforms, iOS, Android, BlackBerry. They have a Google Plus, Facebook page. I'm sure they're on Yelp. And they also have traditional mediums like Public Access Hour on KCAL, as well as sponsor of a film festival. And the app itself is very sleek, very similar to like a YouTube. They have a search, favorites, popular, available in English, French, and Spanish. And I had the fortune of meeting the founder and CEO, Carol Kirschman, through Dr. Rab, and she would love to work with healthcare organizations to have them promote themselves and offer, again, a very cheap service to them, $5.99 a month, something that even a single physician organization could afford. And then, of course, I think with the trends of WebMD and Answers.com and going to Google to find answers and Wikipedia, consumers, the population is leaning for. They want to engage, they want to find. I think Short Showcase could be the perfect medium for that. And this would be the perfect innovative solution. It would provide free, cheap access to healthcare information and education for those marginalized populations, those genetically, socioeconomically disadvantaged groups, the geographically isolated groups. Of course, it's also could be a great business model for the promotion of local physicians and practices. I think it's falling in the line of consumer thinking that they want to engage, they want to lean in, patient-driven preventative care, and finding the best deal on something local. I think Showcase Shorts can be all of that. And hopefully this leads to the clear disruption that we need within the industry. It can break up that hospital to hospital, that quick-work stitching of multiple specialists not actually providing coherent management. And of course, not the only one who have thought this. There have been several studies that have shown mobile intervention, mobile texting be efficient and somewhat effective in helping with smoking cessation and some low results from helping with childhood obesity, along the same lines of diabetes and helping prevent chronic disease. And there was another study that showed effectiveness at self-management of long-term illness by using mobile technology. There's that lean-in approach again. So I think the Short Showcase can absolutely be that answer. And my references: